Hello, everybody. Thank you so much for joining us today for our U-TTEC Lab webinar series this year. Today's webinar is on Do Safety Plans Effectively Support Marginalized Adolescents? A Gap in the Literature. Your presenter today is Elizabeth Goldsmith. Before I introduce our presenter for today, I just want to go over a few key reminders. The talk will run up until about 2:45. We'll have a question and answer session towards the end of the hour. So if you have any questions, comments, or concerns you would like to share, please feel free to drop that in the chat box. Please remember to mute your sound throughout the whole presentation. And if you're comfortable, feel free to turn on your video. Like I mentioned, your presenter for today is Elizabeth Goldsmith. Elizabeth is a doctoral student in the school psychology program at the University of Utah. Elizabeth is also the lead graduate student at the Ascend program. Welcome here today, Elizabeth. We're so excited to have you here. I am going to go ahead and turn the time over to you.
Perfect. Okay, we can go ahead and get started. I'll just share my screen. Okay, so to get started, thanks everybody for coming today. So before we get started, like Annie said, my name is Elizabeth Goldsmith. I'm a third-year student in the school psychology doctorate program. And my research is primarily focused on ways to mitigate suicidal ideation for youth who are marginalized by race, ethnicity, gender, and sexual orientation. And the last thing before we get started, this presentation is sort of part of a bigger paper that I'm working on with a person at the U named Dr. Becca Huber. So I just wanted to thank her for her support. Okay, we're also, before we get started, just as a content warning, in this presentation, we talk a lot about death by suicide and suicidal ideation. And I know those are sensitive topics, so I just wanted to give everybody a heads up. Okay, so to give you an idea of what to expect throughout the presentation, I've laid out a little bit of a roadmap. So I'll start by simply talking about what safety plans are, and then I'll move into talking about how safety plans have been adapted and modified to be the most effective for target populations. And then from there, we'll discuss how safety plans may be less effective for marginalized youth. And in that section, I'll specifically be talking about LGBTQ youth, youth of color, and adolescents from low SES households. And there will also be a little bit of a discussion portion in the middle, so stick around. Okay. So what are safety plans? Safety plans are essentially written lists of coping strategies. I'm sure many of you know these things. We've probably all experienced using safety plans, but it's good to go over what they look like typically. So safety plans are also typically created in response to a student, patient, client, or anyone really who's endorsing imminent suicidal ideation. Their ideation is considered imminent if a child endorses a plan, means, and intent, but it's best practice to make a safety plan with any level of concern. Safety plans are also typically made collaboratively between an individual who's endorsing suicidal ideation and their mental health provider, whether it's like a school psychologist, a therapist, social worker, anyone in the mental health field. Safety plans can also be made in an inpatient setting, day treatment center, during individual therapy, at a school, also really anywhere that a mental health provider might be interacting with somebody who could be endorsing suicidal ideation. The goal of a safety plan is to list strategies that the individual in crisis can use if they begin to feel suicidal again in the future. And by creating the plan in advance, the idea is that the individual will be more likely to use the tool than if they had to come up with different strategies on the spot. And then the plan itself is a list of tools and supports the individual can use to de-escalate. And that's sort of a lot of information. So we'll take sort of a closer look. Okay, so first of all, there's a couple of things that we generally know about individuals who experience suicidal ideation. The first thing to consider here is that suicide is currently the third leading cause of death among adolescents, accounting for 24.5% of deaths for youth between ages 10 to 19 years old. which is huge. And it recently bumped it down to the third. It was for a really long time the second leading cause in the nation for this age group, but now it's behind homicides. Something else that we know is that the best predictor of somebody dying by suicide is if they've had a previous attempt. Lastly, individuals experiencing suicidal ideation have a really difficult time imagining future events. And I'll talk about this last point and its importance in a little bit. So although I mentioned suicidal ideation before, safety plans can also be used when students report self-harming behaviors or endorse homicidal ideation. So this might look like a student or a client showing cuts on their arms or engaging in something like headbanging behavior. And homicidal ideation might look like a student saying that they want to kill or harm somebody else in their life. Okay, so now let's take a more specific look at what safety plans actually entail. So the first thing that most safety plans entail is potential warning signs or triggers. So potential warning signs or triggers might look really different depending on the person. Warning signs typically have to do with how people feel or how they behave. So for example, a warning sign might be if someone starts to feel antsy or start picking their skin or pacing back and forth, any behavior that's unusual to them. Whereas triggers are typically events that happen in somebody's environment. So these might be things like getting a phone call from somebody who's caused pain in the past, or seeing something on the news that brings up scary memories. The next thing on most safety plans is coping skills. And coping skills, as most of you all know, are tools that can help calm us down. So some examples are like box breathing or exercise, mindfulness activities, or my personal favorite to do with kids is having them put their face in a bowl of ice water. And listing potential coping skills is a really important part of safety plans. And it's really important to make sure that the individual who's in crisis knows how to use them ahead of time. So earlier I mentioned that people experiencing suicidal ideation have a more difficult time imagining future events. So making sure the student knows how to use their coping skills and has time to work with their mental health provider to think through future scenarios when they would use those skills is really important. Otherwise, if you just list skills, the student might have a really hard time imagining when they would use those in the future, and then they become significantly less effective. The next thing is listing individuals who can provide distraction. So this step is pretty self-explanatory. It involves listing people who the individual can reach out to for distraction, like a close friend or family member. Really interestingly, a study was done that found that the people who are most likely to be reached out to in crisis are those who are perceived to handle stress really well, and those who selflessly are perceived to prioritize the existence of the person in crisis over their own experience. The next thing is individuals who can help directly resolve or intervene in crisis. So this step is really similar to the last, but differs in the intent and the responsibility of the individual. So ideally, this step is people who are like parents or guardians, therapists, or responsible adults in the person's life, whereas the people who are causing the distraction or can help with the distraction piece might be more like friends. And then the next thing is mental health resources. So oftentimes mental health personnel will have resources pre-filled on safety plans. And so what I've commonly seen here in Utah is the therapists will list their own contact information, their own name, and then additional community resources like things like MCA or Safe UT or any other national crisis hotlines like the Trevor Project. Finally, the last step is thinking about ways to reduce access to lethal means, and this one is really important. So this last step can be done with the individual in crisis. So before doing the safety plan, the child has likely endorsed a plan for how they would potentially harm themselves or somebody else already. So because of this plan, it's important to ensure that they don't have access to whatever they were wanting to use to harm themselves or somebody else. And it's important to make sure that this plan is communicated with their parent or guardian. So making sure if, for example, a student was planning on overdosing, making sure they don't have any access at their home or in any other community setting to those lethal means or substances. Okay, so when safety plans were originally developed by Stanley and Brown, they were designed for anybody experiencing suicidal ideation. However, it was apparent that some groups are at higher risk of experiencing suicidal ideation or actually dying by suicide than others. So in response to that data that we started to understand when looking at patterns of suicidal ideation across the country by group, it was clear that there was a need for support for these higher risk populations, and adaptations and modifications were made to specifically help certain populations. The main group that has really benefited from this is veterans. So as you can imagine, veterans have a really high risk rate of experiencing suicidal ideation throughout their lives. So it's really important that this population gets the support that they need. So to give you an idea of how modifications were made for veterans, one study added a meaning of life question at the end of safety plans, where veterans were prompted to describe what they believed to be the purpose of life. And the idea of this was that if they were to identify and recognize the meaning of life, they might have more encouragement to recognize the value of their life or have encouragement to stay alive. Another population where there have been modifications to safety plans is for older adults. So I didn't know this, but older adults above 65 years old have a higher rate of experiencing suicidal ideation. And this is primarily because of social isolation, physical illness, and functional limitations that they might experience later in life. So because of this, prompts have been added to safety plans that really encourage older adults to think through potential help-seeking behaviors that they can engage in if they are in crisis again in the future. Okay, so when we're thinking about adolescents, since 2021, there's been a huge increase in research for how safety plans can be adapted to most effectively help adolescents. The main way that they have been working towards this is through integrating technology into safety plans. So these interventions allow youth to have access to their safety plan all the time and have those resources just at a link, and they can just be connected directly to them. And this is great because it's really hard to believe that a teenager in today's world is going to carry around their safety plan on a piece of paper everywhere they go, but we can almost guarantee that they will have their smartphones and can access this safety plan wherever they're at, which is great. Other adolescent adaptations have focused on incorporating motivational interviewing into the collaboration process between the mental health provider and the youth. Okay, so now we're going to open up for a little discussion for a few minutes. So I just want to take a moment. This is a image of an example of a safety plan. And so I know there's not a ton of people on the call, but I want to hear if anybody has any thoughts thus far before we talk about how marginalized youth may not be benefiting equitably from these. If anyone has any ideas of how LGBTQ youth, youth of color, or low SES youth might not be getting their full support through safety plans as they are. If anyone has any thoughts. It's okay if not.
I have a thought, Elizabeth. I'm just wondering about this step 6 and making the environment safe, and maybe how much control there is there for environments that some of these kids are experiencing.
Yeah, I think that's a really great point. I think that oftentimes we think that this is sort of a relatively simple one. You call their parents, and ideally a situation or a place or a home or community space is made safe for the individual. But I think that that is really easier said than done. And sometimes parents don't respond in that way, or maybe they don't have access to ways to make their house safe. So for example, if there's lethal weapons in the household, some families don't have safes or ways to really protect those lethal means from being accessed by their kids. Does anyone have any other thoughts or ideas?
I think just in general, they have less resources. Oftentimes, like for example, on step 3, people in social settings that provide distractions, like they might not have a way to get there if it is low SES, or in general, there just might not be a lot of safe people in their life. I don't know.
Yeah, absolutely. I think that when we think about safety plans, we often imagine a world where these kids often have, a really great group of friends or resources in terms of personnel that they can go to, but sometimes that's not the case. And sometimes I think that's a really great point that you brought up, Maddie, because what if asking this question makes a kid feel like they sort of recognize that they don't have as many friends as this safety plan maybe suggests that they should or could have. That's a great point. Any other thoughts? Nice. Alicia agreed with step 4. Yeah, so asking people who can directly support or help with intervening with the crisis. I totally agree. Or maybe like with low SES, maybe parents aren't always available. Maybe people have jobs or at work and can't just drop everything to support in a crisis. I like that point, Alicia. Okay, so we can move on. Thank you all for the conversation. So now we're going to take a closer look at the relationship between safety plans and marginalized youth. So we're going to start off by talking about LGBTQ youth and why they need to be part of the conversation of death by suicide at all. So LGBTQ youth, we know, are 3 times more likely to attempt suicide than their peers, and 45% of LGBTQ youth seriously considered attempting suicide in the past year. And these are really big statistics and really important to consider. And a lot of this information and what will be coming after this is from the Trevor Project, and they often every year, every few years, send out a national survey to understand how LGBTQ youth and youth of color are experiencing and navigating their lives and things like depression, stress, anxiety, and suicidal ideation. So something else that we know about LGBTQ youth is that those who report having at least one adult in their life who accepts their identity are 40% less likely to endorse suicidal ideation. So if we want to put it in another way, if a student is gay, if just one adult in their life is okay with that, they're almost half as likely to feel suicidal. On the other side of that statistic, we can see that if an adolescent is queer and the adults in their lives are not okay with that, the likelihood of them being suicidal drastically increases. So if LGBTQ youth who lack affirming adults in their lives are the most likely to be suicidal, what adults are they supposed to list that would be able to help them in that moment of crisis? So sure, like some adults might be willing to intervene if there is a crisis despite the individual's identity that they may disagree with, but how much support does that really give the child? It doesn't really give them support to the extent that is likely needed. So we can consider youth who are not out yet in the same way. So in this scenario, the same question arises of what adults or trusted adults in their lives they're supposed to be listing here. Okay, so now let's shift to youth of color. So oftentimes there is an emphasis on the high rate of white males who die by suicide, which is a really important conversation, but sometimes it means the rate of dying by suicide and suicide attempts of youth of color are not the primary topic of conversation or research. So let's take a look really quick at why youth of color need to be a critical part of the conversation when we're talking about suicide. So first, there was a drastic increase in the suicide attempts by Black youth between the years of 1991 and 2017. The increase that occurred was about 73%, which is huge and really concerning. And that number is also likely to be larger because the suicide rate of BIPOC youth is often underrepresented due to report categorization. So what I mean by this is that it's been found that police reports often miscategorize suicides among BIPOC individuals as being related to things like substances or violence in the neighborhood. So the rate of actual deaths by suicide is likely much higher than is represented oftentimes in statistics, which is really problematic for them being able to access help, as well as shifting the focus of research to helping all individuals. And then lastly, Indigenous people in the United States have the highest rate of suicidal ideation compared to all other races. So when we consider safety plans for BIPOC youth, we have to really think about those community resources because BIPOC youth might be less likely to contact community resources due to threats to their own safety and well-being or fear of potential police involvement. On top of the resources, psychology as a whole has a really racist and problematic history and roots that have really fairly resulted in an increased stigma and distrust of the mental health field among many communities of color. So the resource section of a safety plan requires thinking about what resources would actually benefit students of color specifically, as opposed to taking this broad one-fits-all approach. So now let's talk about SES. So something that we know about suicide rates among low socioeconomic status adolescents is that in the United States, children and adolescents are 37% more likely to die by suicide if they grow up in areas where at least 20% of people live below the poverty line. We also at the same time know that 1 in 6 low-income households do not have internet access. But at the same time, the adaptations to safety plans that are being made for adolescents, as noted before, are primarily rooted in an integration of technology. So this means the practices of safety plans is developing quickly, but they may be less and less accessible for youth in low-income households. The same goes for many resources that are listed on safety plans. So for example, the Safe UT app is a really incredible intervention that allows access for supports like talking to a counselor at any time of the day and is really making a huge difference in people's lives across the state. But if low SES children do not have access to smartphone apps, they may be unable to access this type of resource. Okay, now I am a really firm believer that it's inappropriate to talk about race, gender, or sexual orientation or SES without also talking about intersectionality. So to define intersectionality, I'll read one of Kimberly Crenshaw's original ways of explaining the term, where she said, intersectionality is a lens through which you can see where power comes from and where power comes and collides, where it interlocks and intersects. It's not simply that there's a race problem here, a gender problem here, and a class or LGBTQ problem here. Many times the framework erases what happens to people who are subject to all of these things. So to put it another way, for example, if a student is Hispanic, transgender, and low SES, those areas of identity overlap, and I like to say they stack on top of each other to create unique sets of obstacles and or opportunities. So I'll start off by reading some facts about intersectionality. So LGBTQ youth of color reported higher rates of attempting suicide than their white peers in the past year. 58% of Black, transgender, and non-binary youth seriously considered dying by suicide in the past year. And low SES disproportionately impacts Black and Hispanic youths. So it's really important to consider this intersectionality when we're considering resources for all youth regarding suicidal ideation. This is another way of showing it. So this is just a quick graph for any visual learners out there that depicts the percent of youth who report suicidal ideation in 2014 by race and whether they were part of the LGBTQ community. So you can see that those who are both youth of color and members of the LGBTQ community have a significantly higher suicidal ideation rate across races compared to their straight white cisgender, or sorry, just their straight cisgender peers. So you can see the dark lines, the dark bars are individuals who are a member of the race that's listed below and part of the LGBTQ plus community. And the lighter gray bars are indicating individuals who are members of those specific races, but not a member of the LGBTQ community. And you can really see the difference there. Okay, so to look at the impact of intersectionality another way, I want you to think about all the statistics I've mentioned earlier about race and sexual orientation and gender and SES regarding suicide rates. So now think about how those statistics become exacerbated when an individual is marginalized by their race and sexual orientation, their race and socioeconomic status, their gender or socioeconomic status, and now consider the level of risk for those who are marginalized by all three of these factors. So if a student is Black, queer, and of low SES, safety plans may be failing to support them in not one, but multiple areas. So more explicitly, because they're a student of color, they may be less likely to rely on the community supports and resources that are listed. Because they're queer, they may not have close friends or adults who they can trust to talk to. And because of their SES, they may not have access to the technology of new safety plans or many of the current local or national resources that are often listed. So what's the point in all of this? So what we know is that the rate of suicidal ideation and death by suicide among adolescents is a national crisis right now. We also know that outside of hospitalization or inpatient treatment, safety plans are really one of the main methods used to help reduce suicidal ideation. And at the same time, we know that youth who are marginalized by their race, gender, or sexual orientation or SES are at a higher rate of experiencing suicidal ideation, but safety plans might be less likely to support them. So basically what I've outlined is a huge problem and gap in our system. Safety plans are something that we rely really heavily on as working in the field if we can't get somebody hospitalized, but they really might not be working for all students who don't fit inside this safety plan box that it's expected to, which is really unfair and not giving the supports that are needed, especially for a really high risk population. So now I want to open it up to a discussion and talk through some of these issues. So what can we do about this? So the first question is sort of thinking about how can safety plans be adapted and modified to serve all youth? And then the second one is, which safety prompts do you all think have the highest impact on reducing risk? Because if we know that, maybe we can focus more energy on the specific items to focus on when doing safety plans. So I'm going to open up for discussion. If anybody has any thoughts on either of those ideas or any thoughts or questions in general.
Yeah, Elizabeth, I have an immediate thought about if there's any way to actually kind of provide some of those things that we're asking in the safety plans for these kids to provide for themselves. I always think a really important thing is having a specific person to turn to. So this is like a really big thing that, you know, to get done would be really difficult. But I almost just wonder, you know, if we were able to assign a sort of point person that any of these kids could be getting in touch with when they're running into these issues, and then it's someone that they can know and trust and start to build, you know, a relationship with.
Yeah, I totally agree. So ideally, maybe someone like a school psychologist or school counselor could be someone who could act in that way. Like, I mean, ideally, school counselors or like school psychologists or social workers in schools are people who students could trust and rely on to not be biased based on their race or LGBTQ status. And I think having that person as a point person who, regardless of your identity and who you are, could be somebody that could be really relied on. And I think that like social workers are a great resource in that sense, where they could maybe go out to somebody's house and help them reduce lethal means in the household or create more safeguards in that type of a way. It's a great point. Does anybody have any other thoughts? Something that I think about when looking at the items on the safety plan that are impacted by marginalization is it's really mostly things that include community supports and resources. So what we're leaving these marginalized youth with is really a need for them to rely on themselves, like with the coping skills. All youth, regardless of marginalization, can likely engage in the coping skills. That's putting a lot of resilience, expectations, and self-reliance onto these youth, which can be really hard. Obviously, a huge piece of mental health and having supports is being able to reach out to others and not simply rely on your own ability. Does anyone else have any thoughts? It's okay if not.
I guess just thinking about those things too, that it might be helpful to have like a sort of, I guess, multi-tiered delivery system of some of these resources to try and, you know, combat the fact that some of these kids are not able to get, you know, help they need because, you know, they're low socioeconomic status and things like that.
Yeah. Yeah, I think that's a really great point. Or like, yeah, maybe low SES students could, like if hospital or school systems could set them up with access to technology if that's a barrier and they know that the student is suicidal.
Yeah.
Thanks, Alicia. Anyone else have any other ideas? It's really tricky.
I don't know if this, I mean, this is difficult. Like you said, it's hard to put a lot of responsibility on the kid, but I think it is important that it is a little bit more individualized, like maybe where you start out with someone making a safety plan and saying like, what do you do when you do feel unsafe, and then kind of build off of that as to how to modify it for that specific person instead of going through the template. I don't know. That's my idea.
Yeah, I love that idea. I also think really being like explicit with the kid and saying, are these resources that you would actually contact, or is there a barrier that you foresee experiencing if you were wanting to? Or thinking about, you know, I know that maybe part of your suicidal ideation is related to your sexuality. Are there people in your life that you're willing to talk to about that can support you with that information? and just being really clear and explicit and open to talking about that with kids who are experiencing these things. I like the idea of, I think we often try to go for the one-fit-all approach because it's really easy or simple, but that might not be the best method here.
Yeah, for sure.
Thank you. Okay, so the last thing that I have is just some resources. So I've included Safe UT, a really common one, the Mobile Crisis Outreach Team, MCOT, and then the Trevor Project, which is the national hotline that really supports LGBTQ youth and youth of color. And that's all I have, unless people have any other questions or thoughts. Perfect. Well, thank you all for coming. I really appreciate it.
Wonderful. One big virtual round of applause for Elizabeth today for speaking on today's topic. Thank you so much for being here today. This presentation is recorded and will be uploaded to the U-TTEC Lab YouTube channel, as well as the website. For more information on upcoming webinars and just any additional information, feel free to visit the U-TTEC Lab website by going to U-TTEC lab.com. Again, thank you everybody so much for coming. Hope you have a great day.